Assalamu alaikum wa rahmatullahi wa barakatuh. Today I'm going to talk about a review paper that was published in 2022 in the International Endodontic Journal by Burns et al. It was an updated systematic review of longitudinal clinical studies published between 2003 and 2020. So as we know, the root canal therapy aims to prevent or eliminate apical periodontitis of endodontic origin. The success rate of root canal treatment is critical in preserving natural dentition. A landmark systematic review by Nick et al. In 2007 and 2008 analyzed studies published between 1922 and 2002, reporting pooled success rates ranging from 68% to 85%. However, due to an advancement in endodontic materials and techniques, an updated analysis was necessary. And this review aimed to quantify the success rate of primary root canal therapy, published between 2003 and 2020, and to also investigate the influence of key clinical study characteristics on treatment outcome, including operator qualification, year of treatment, geographic location, presence of preoperative periapical lesions, and instrumentation methods. So their findings were that the weighted pool success rates of primary root canal therapy published between 2003 and 2020 were estimated to be 92.6% under loose criteria, which is defined as a reduction in size of existing preapical lesion, and 82% under strict criteria, which is defined as complete resolution of a periapical lesion. So the presence of a preoperative periapical lesion significantly reduced the odds of treatment success, which were the odd ratio was 2.75, indicating biological factors have the most significant impact on the root canal therapy outcomes. The method of instrumentation, including the use of modern rotary nickel titanium instruments, did not significantly affect the treatment outcomes, suggesting technological advances have improved efficiency without compromising the success. The qualification of operators, general dentists, postgraduate students, and endodontists showed no significant effect on the success rates, although most of the cases treated by specialists may involve more complex cases, which may influence the outcomes. So studies with a minimum of 4 years of follow-up showed also a better outcomes compared to those with a shorter follow-up period, where the strict criteria were applied. And the majority included studies, 64.29% were considered to be of a low quality of evidence based on the grade approach, with randomized controlled trials representing only about 35.7 of the studies. Despite calls for using CBCT for outcome evaluation due to its higher sensitivity, only few studies incorporated CBCT, and it tended to show a lower success rates than traditional radiographic evaluation. So let's compare the changes over the years. A previous comprehensive review by Nick et al. In 2007 included studies from 1922 to 2002 with success rate of 74.7 for the strict criteria and 85.3% in the loose criteria. This updated review showed improved success rate, which were 82 for the strict criteria and 92.6% for the loose criteria in studies published between 2003 and 2020. And also the weighted pool success rate based on the year of treatment were similar before and after 2000s, indicating that the improvements in reported success rate may reflect a better study design or other factors rather than the change in treatment years alone. There is an increase in standardization in study design and reporting compared to earlier periods, including more consistent reporting of success criteria and use of multiple calibrated observers for radiographic assessment. Though further standardization is still needed, the increased use of randomized controlled trials and more rigorous methodologies compared to prior reviews reflects progress in the quality of endodontic outcome research, although a large proportion of the study remain of a low evidence quality. So In summary, the study shows that the primary root canal therapy outcome have improved over time, with biological factors like preoperative periapical lesions being critical determinants of success. Technological advancements such as rotor instrumentation have not changed the success rate significantly, but have likely improved the treatment, and the quality of evidence has improved somewhat compared to earlier decades. But further standardization and higher quality studies are still needed. And lastly, the limitations of this study were the heterogeneity among the studies, also the lack of data regarding other factors that are considered to impact the clinical success of the root canal therapy, and lastly, the risk of bias to study assessment. And thank you.